Hi, my name's Ian Wright, and this is Holistic Thinking Part 2. And this is just picking up a series I started previously on how we think about particular issues and conditions. And it's kind of introducing this idea of holistic thinking, meaning really that we're looking at a particular issue from a variety of different perspectives or different ways into it. So anybody who presents with any particular problem, symptom or condition, there's a lot of factors that are involved. And for me, what's actually very interesting is to act like a detective, to unravel the story of what's going on with them, to try and find out pull out the kind of key threads to unravel the kind of knot. In a way, that's in a way the metaphor for what it is. And this one I'm going to talk about is glue ear, and it's a hypothetical. I'm going to talk hypothetically, make up kind of a story as we go along, but it's just a kind of an illustration of how we think. And this is for students and patients and osteopaths and whoever wants to hear it. Anyway, so let's take, say, for example, a 3-year-old child who's having difficulty hearing. So this person is having difficulty, they're slow to speak. The first thing that you want to look at is, why are they not speaking? Is there a neurodevelopmental issue, in terms of the development of the parts of the brain with regards to speech and language? One of the most obvious causes of a delay in speech is a difficulty in hearing, because you can't hear what you're saying. If you don't hear well, speech and language are slow to develop. And speech and language, it's important. It's a very important stage in develop is when speech and language come. And if there is a problem with hearing, it needs to be cleared really as quickly as possible to help facilitate the speech and language development, because the brain is very plastic at that time and it's wiring itself up. And actually the freer it can be to wire itself up, it helps for later. So it's kind of important to maximize the chances of speech and language development. So we've got this 3-year-old who's slow to speak, and we find out through hearing tests or actually through the case history from the parents that actually this child is having difficulty hearing. Okay, so they may have something called glue ear, or another term for it is chronic serous otitis media, which is a middle ear blockage, and it's normally through a fluid blockage in the middle ear in the eustachian tube. Okay, so what is happening here? So what you have is there's a fluid tube that goes from the inner ear down into the top of the back of the throat, okay, and it goes through the eustachian tube, and it's fluid filled, but it's meant to have drainage. Now, in glue ear, it blocks up, and when it blocks up or gets inflamed, it obviously can cause problems. Now, why? Why do people or children especially, get glue ear? Well, there's a variety of kind of anatomical reasons why they would have a tendency to get glue ear, and I'll just keep it quite superficial. But one of the most important things is the eustachian tube, which goes down towards the top of the back of the throat. Because of a child's shape, their architecture of a face, the kind of maxilla, which is the upper part of the below the nose and down into the jaw, is quite small. A child's face is quite small, and actually when they get between the ages of 5, 6, 7 years old, that lower part of the face tends to grow, and that's when kind of a baby face goes into a child face. There's a change in the structure. Baby faces, the face is very, very small, and especially babies, and it goes through this growth period to kind of expand that lower part of the face. Now, inside is the eustachian tube, and that follows this line. Now, what happens is the eustachian tube sits at a horizontal angle up to the age of, say, 6, 7 years old, when because of the growth of the face, it goes down to, say, a 45-degree angle. Now, so if you've got a straight tube which is fluid filled, it doesn't drain so easily that as one, because it doesn't involve gravity, as one that's 45 degrees. So in children, you have this tendency for that ear to be blocked to some degree. But there's an awful lot of other factors that are involved. So if you're looking at a child who has a blocked eustachian tube, you look at why now. I'm just going to whiz through some of the factors that could be involved in this, which makes it kind of interesting to try and discern what's going on. One of them is to do with the drainage of the throat. The eustachian tube drains into the top of the throat. If there's some sort of blockage in the throat, large tonsils, lack of drainage through particular throat issues, that it will back up into the ear, and that can cause problems into the inner ear, and the middle ear. It can cause problems. Also, children who've had a tongue tie, where the palate has been kind of locked down, some of the small muscles that link up with the palate and to the inner ear help pump that tube. And so if you've had a tongue tie where everything has been locked down through that part of the face and upper throat, it can predispose to a lack of drainage through that ear. There are other things which are important more from a kind of osteopathic viewpoint. The temporal bone, which the ear sits in, has this kind of gentle gliding motion, which acts like a pump to pump the eustachian tube. Now, there's a variety of reasons why that temporal bone isn't as free as it could be. Just for example, one of them is that temporal bone has a very strong attachment to an area called the tentorium, which is a kind of dural membrane. And for example, in a child who's had a vacuum delivery, a ventouse delivery, where all the membranes have been dragged and pulled backwards and kind of locked down, it can make them irritable, it can make them colicky. But it also can lock up the temporal bone because of that strong attachment of that membrane. And that may not have any effect in a tiny baby, but actually as they get older, 2 or 3 years old, this temporal bone blocking can make them prone to middle ear infections and a lack of drainage. So what happens is the fluids that aren't draining very much tend to get inflamed and you get an infection. So glue ear doesn't necessarily link up with middle ear infections, but middle ear infections can lead to glue ear. So they do obviously cross over. It's the same part of the anatomy. Another thing is babies, when they're teething, when you're teething your molars and some of the back teeth, especially the molars, the jaw, of course, hangs from this temporal bone. So when a baby is teething, it locks up the jaw, and that locks up the ear bone, the temporal bone, which can cause inner middle ear infections, or it can block up the ears and cause kind of a glue ear situation. So you've got a lot of anatomy here that kind of links up, and what we as osteopaths do, we're trying to free up the blocks, especially in terms of the temporal bones in this situation. A free temporal bone helps pump it down into the back of the throat and helps it to drain. But there are other factors that are involved, and that could be to do with actually the fluid, the mucus fluid that's in that middle ear, which is actually important in terms of immune function, but it can become inflamed, irritable, or you can produce too much mucousy fluid, and it can be too thick. And that can be linked to certain triggers. Certain triggers can cause that, one of them being lactose intolerance. There is a part of the immune system in the gut and in the lungs and in the inner ear that all kind of connect up. So if you eat or drink something, there's something called the mucosal associated lymphoid tissue that reacts, and that can react in the lungs at the same time or in the inner ear. And it's interesting. So eating something can have a reaction, like you can trigger, say, for example, an asthma by eating something that you're allergic to, or you can produce this kind of thicker mucus in the inner ear because you've eaten something. And the most classic is a lactose dairy intolerance. Now, that doesn't mean you've got a proper allergy to it. It could be a very subtle reaction which just acts to produce a little bit more mucus. But that, linked in with everything else we've got, can cause problems, of course. Now, other things that can cause a reaction, like an allergic reaction in the inner ear, have been shown to be things like cigarette smoke. A baby's are particularly sensitive to cigarette smoke, and it can produce a reaction in the inner ear through the lungs. So you've got that lung connection with the inner ear. So there's a lot of things that are involved in the immune system, in the mechanics of the ear, in the drainage of the ear, in the anatomy of the ear, that all can connect up. So what do we do? It depends on where you're coming from. As osteopaths, we want to free up the temporal bones. Any lack of drainage or movement and function, if their child is teething, or if everything's been dragged and blocked by a complicated delivery, because these bones can get a bit squashed and locked up in complex, difficult deliveries. If they've had, say, they've been stuck in stage 1 of the labour for a long period of time, and there's a kind of axial compression through the head, or things like forceps, vacuum ventouse deliveries, etc., etc. So we want to free it all up and also get the drainage of the throat working. That's very, very important. We also can maybe look at if there's an intolerance to lactose or anything else in their diet that could be producing this kind of mucus response or this immune response. We can give exercises where we can teach the parent to help kind of pump the ear to get it draining, which is a kind of way of pulling at the ear and just releasing it in a gentle kind of rhythmic way to help the pumping. Or we can help do some kind of teach the mother to do some kind of help with the lymphatic drainage in the throat. So you've got all of those kind of things that can be helpful with glue ear. But then if those things you have to go deeper, and there's grommets, T-tubes, etc., which, they obviously have difficulties because they scar the eardrum, but actually sometimes they're very necessary because speech and language are developing, and it's very important, and is hearing, and you need to hear, and it's very important to hear because we're in this lovely window of development of speech and language. So there are layers, as far as I'm concerned. There are layers of treatment, and you want to do something more gentle first of all, and then do some of the more radical stuff which involves surgery, etc., as more of a last resort, which is equally relevant and necessary if it needs to be done. But the point with all of these conditions is managing it, how to manage it, how to pull out the threads of what is the issue causing it, and trying to address it. Is it removing milk, lactose, etc. from the diet? Is it getting the temporal bone free, or is it referring them off to an ENT so they actually have a grommet or a T-tube inserted? That's the point in discerning and trying to work out and to diagnose what's going on. Anyway, this is a massive subject. If I was lecturing on this, there'd be a lot more complex anatomy involved, but this is just an introduction to all the different ways of thinking about one condition, and we can do this about every single condition that we treat in practice, and anybody, or a doctor treats, or an osteopath, or whatever. It's about this discernment of what's going on, and that's what makes it very exciting. That's why I really enjoy it, because you're acting like that detective trying to work out what's going on and trying to solve it. Anyway, I wish you well.